LCIF is a global force for the good of humanity, supporting the efforts of more than 1.4 million Lion members embedded in communities across more than 200 countries. For over 100 years, wherever there's a need, there's a Lion.
The Texas Diabetes Institute is one of the nation's largest and most comprehensive centers of its kind and is a critically important element of service within the university health system. Thousands of members of our community in South Texas suffer with diabetes. The professionals here conduct research and provide clinical care and treatment as they wage war on this terrible disease. Today, we will be visiting one of the specialty clinics, the ophthalmology clinic, staffed by professionals of the UT Health San Antonio Department of Ophthalmology, and learn of a wonderful project that has just been completed to help them serve patients suffering with diabetic retinopathy. It's been my privilege to serve as project coordinator, having been appointed by our District Governor Lion Janie Garza to represent my fellow Lions of the 64 Lions Clubs that make up District 2A2 of the International Association of Lions Clubs. Some 38 years ago, our District Lions organized their own Lions Site Research Foundation, which has had the good fortune to have had a long-standing partnership with the UT Health Ophthalmology Department. And the project that we will show you today is an expansion of one of the Lions named facilities that partnership has produced. But although the area Lions raised a good portion of the funds needed for this project, the project would not have come about without the help and financial support that the local Lions received from a large grant provided by the Lions Club's International Foundation that we call LCIF. Lions throughout the world raise funds and contribute to the LCIF war chest that is then used to conduct humanitarian service activities in their communities. This wonderfully collective support empowers all Lions to better live the Lions motto, "We serve." And there is no limit in the ways that Lions serve. In fact, we also live by the phrase, "Where there is a need, there is a Lion." But the most primary of our areas of service is to help the blind and visually impaired. You see, we were challenged to do so in 1925 by Helen Keller. And we strive energetically and enthusiastically to earn the title that Helen gave us as Knights of the Blind. This project is just the latest way that District Lions, with the tremendous help of LCIF, along with their partnership with UT Health San Antonio, are serving our fellow community members. The project itself consists of the addition of exam area and acquisition of state-of-the-art imaging equipment to better study and treat diabetic retinopathy.
Hi, I'm Dr. Dan Johnson. I'm the Chair of Ophthalmology here at UT Health in San Antonio, the medical practice for the Joe R. and Teresa Lozano Long School of Medicine. Our department is one of several clinical departments of the School of Medicine, and as a department sees over 50,000 patients a year at our 6 sites, as well as provides comprehensive trauma and emergency services for University Hospital, which is part of University Health System. One of our busiest sites is our clinic here at the Texas Diabetes Institute, where we provide all the medical care and all the clinic administration for the eye clinic. Our department has had a long and wonderful relationship with the local Lions Club, Lions 2A2, and is absolutely grateful for the support that it and Sam Pantusa have given us over the years with respect to the Lions Low Vision Rehabilitation Center, the Lions Resident Surgical Skills Laboratory, the Lions Eye Pathology Laboratory, the Lions Site Research Center, our collaboration on the Mobilized Screening Unit, and now here with our expansion of the Eberlin Research Center at the Texas Diabetes Institute. This expansion of the Eberlin Research Center through the just incredible generosity of the local Lions in collaboration with the LCIF and Sam Pantusa is going to allow us to continue to provide cutting-edge research as well as to make eye care even safer here now in the setting of COVID. As you're aware, eye exams take time, in part due to the long time it takes for a patient's eyes to dilate to allow the ophthalmologist and optometrists to look at the retina, which is the main victim of diabetes in the eye. And so now with this expansion and the additional eye lane that we have, we're able to allow patients to sit in the room while they dilate and no longer have to use waiting rooms to allow continued movement through the eye exam rooms. The equipment itself which again is an incredibly generous gift from the local Lions and LCIF, allows us to continue our research as well as to provide incredible diagnostics for the patients that we have. Our department is intricately involved with the research practice of our institution, and we as ophthalmologists are involved with several trials for cancer chemotherapy, therapeutics, new medications for diabetes, many of which can have effects on the eyes. And so words really can't describe how grateful we are to Sam, the local Lions, as well as LCIF for their providing us this expansion, actually providing the original Eberlin Center and now providing the expansion of the Eberlin Center for both our research and patient care missions. So thank you very much.
Hi, my name is Jong Sun. I'm a director of Texas Diabetes Institute Ophthalmology Clinic here in San Antonio. Our Texas Diabetes Institute Ophthalmology Clinic is at the center of San Antonio, South Texas, one of the most prevalent diabetes and diabetic retinopathy areas. It is also located in the medically underserved area. We have a busy eye clinic here with 1,900 to 2,000 visits per month and about 23,000 visits per year. Your valuable support was used to purchase the Optos Wide Field fundus camera, Zeiss optical coherence tomography angiography, and to make one extra eye exam room in our clinic. This eye exam room will have additional 5 to 7 patients a day, 30 patients a week, which will allow us to have another 1,500 patients per year. The Optos Wide Field fundus camera will allow us to have 200-degree view compared to the traditional 30-degree view of the retina. It is useful to diagnose and follow up with diabetic retinopathy. Interestingly, we are starting the clinical study to see the effect of specific diabetic medication on diabetic retinopathy progression using this Optos Wide Field fundus camera. Zeiss optical coherence tomography angiography can examine the retina vasculature without the intravenous injection of fluorescein dye. That is especially helpful for advanced diabetic patients with poor kidney function. And we can avoid the systemic side effect of fluorescein angiography, such as nausea, vomiting, and severe allergic reaction. Your support will help our clinic, research for the better patient's care, and education of the future generation of doctors. Once again, thank you for your support.
As clinical faculty for UT Health, it has been my privilege to work with an amazing group of individuals at the Texas Diabetes Institute. Our administrative, research, clinical staff, and clinical faculty work tirelessly in effort to identify and subsequently coordinate evidence-based therapy for patients suffering from visually devastating complications of diabetes. Diabetes is the 6th leading cause of death in Texas and the 4th leading cause of death in Bexar County, while diabetic retinopathy is the #1 cause of blindness in people under the age of 60. With the help and support of organizations like Lions Club and its International Foundation, our team can improve access to health care and treatment for patients who may otherwise continue without care and intervention. The current project and support by the local Lions Club and the LCIF will not only increase comprehensive examinations by approximately 12,000 patients per year, but the diagnostic instrumentation addition will assist in identifying pathology possibly years in advance from traditional dilated fundus examinations.
We appreciate that you've taken the time today to learn about how lions serve their communities. We're grateful to our UT Health partners and look forward to future endeavors. And I sincerely want to thank our fellow Lions across the world, and also to Lions Club's International Foundation for the dynamic support that was afforded us. To learn more about how District 2A2 Lions help those with vision impairment, check out our website at lionsightresearch.org. And by the way, we're always looking for people who have the heart for service to join us in this effort. Thank you.
LCIF is a global force for the good of humanity, supporting the efforts of more than 1.4 million Lion members embedded in communities across more than 200 countries. For over 100 years, wherever there's a need, there's a Lion.